We'll get started here. This is our weekly Commissioners Finance meeting. Today's date, November 29th, 2023. Pointed out at 1:30 is arrived. Begin with the call to order and an opportunity for any public comment. Do we have anyone online? No. There's additional here who isn't already on the agenda. Okay, we have the minutes in hand for our meeting of November 15th. Need action on that.
Move to approve the minutes of November 15th.
I second.
Okay, it's been seconded. All in favor indicate by saying aye.
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 Motion carries. Okay, brings us to our topics of discussion for today. We have our friends from the State Ag Extension Office here. They'll provide us with a quarterly update. Please proceed.
Thank you for having us here today to give our update. We were just speaking with Stacy that one of the partnerships that she helped facilitate over at the center at Allen Road was to get multiple departments to talk about how to better serve the community. And in March, we came here and talked to you about making our Master Watershed Steward program a full-time Cumberland County position and working with Planning Office, helping to take some of the load that Kirk and Elizabeth have there. And I'm happy to be here today to introduce our new Master Watershed Coordinator, Natalie Marioni. And I'll let her speak to what she's going to do, and then I'll provide you with a few other updates. But I'm just very excited to be here and to thank you for the partnerships that you allow us and to have and facilitate.
Thank you. Thank you. I'm really excited to be moving to Cumberland County and starting kind of my extension journey here. I have been with Extension for 4 years as the Master Watershed Steward Coordinator for Berks and Schuylkill counties. So I'm not yet local, but I will be soon. And I have kind of a long history of watershed work. So I've been in watershed education and research for over 20 years, with the last kind of 12 doing program development, program coordination, and watershed education. So I'm most excited to kind of grow the budding program of watershed stewards here in the county, and really excited about the kind of new aspect of this position that wasn't in the job description before, which is the county action kind of plan part of it, and helping the county utilize and leverage the volunteers to move those initiatives forward. So can't wait to grow the program and see where it takes us.
Sounds great.
And I'll just give you a few additional numbers for the other programs. About 46,000 community members have accessed the Penn State Extension website from Cumberland County. And this quarter, the top topics were farm safety, specifically ag emergency response and training, and health and wellness disease prevention. So I thought that was quite interesting, and we've shared that with our teams to let them know, be on alert, and to have more training materials for folks that might come into the office. We had 1,800 folks attend local workshops, and 1,100 folks come to webinars this quarter. Andy Yensha, our water resources educator, worked with Lacey, our admin, who had seen an increase in walk-ins and calls from folks in a certain township here, Lower Frankfort Township, wanting water testing kits. So Andy is having a class coming up December 19th, a drinking water clinic that will have free testing for Lower Frankfort Township residents. Another volunteer program win that we have is this quarter, we had 5,900 residents that were reached with our horticulture program outreach. That was in-person trainings, emails, and social media. And one of the things that you might have recently seen them in the news was with their partnership with Dickinson College, with their pollinator education programming and demonstration garden at Kaufman Hall. And then later actually at the beginning of next year, our 4-H program is taking several teenagers from the 4-H program up to University Park for the State Leadership Conference. So there's our future leaders here in the community that will be going for a week of training in how to promote their leadership skills. And then one of the things that we tried to respond to for local producers in ag markets, we have Miranda Harple, who you met last quarter, who's our marketing and business development specialist. She's having a Google Analytics workshop here in our Allen Road facility next week. And it looks like that workshop is about a capacity to help local producers market their products using Google. So those are just a few of our highlights, and that's all because of the support that we get from you in the county, and we appreciate all of your support and the connections that you make for us in partnerships.
And do you have any questions for us?
Natalie, will you be working? You may already be working with the Mark Conservation District.
I started 2 weeks ago, so I haven't yet, but we will be, and our program does. Yes, I worked really well with our conservation districts in Berks and Schuylkill counties. So looking forward to, I should meet them more formally in a week or so.
Are you moving?
I'm in Western Berks County, Wilmsdorf. So a little bit of a commute right now.
Welcome.
Thank you.
I don't have any other questions.
Hear anything additional, so thank you for your time.
Thank you. Thank you for inviting us.
That'll move us on to our second discussion item. And this is in regards to use of opioid settlement funds to cover cost of medication assisted treatment at prison. So we have Jack Carroll and Rebecca Pinky with this from Drug and Alcohol and the prison. So you're
Okay, I'll start. Thank you for scheduling us. We're ready for the next step, I think, with Cumberland County's opioid settlement funds. As a quick reminder, one of the new responsibilities that falls on county prisons is providing for the cost of opioid-related medication-assisted treatment. And there's 3 different FDA-approved forms: Vivitrol or naltrexone, methadone, and buprenorphine, Subutex, Suboxone. And because when somebody is incarcerated, they're not eligible to use their private insurance if they're lucky enough to have it, or medical assistance. They're not eligible for medical assistance. The full cost of absorbing the cost, the full responsibility for absorbing the cost of MAT in the prison will fall on the county's budget, basically, the prison's budget. So as we had recommended previously, we think a top priority for the county's use of opioid settlement funds should be to make sure that these new costs are covered. And so previously, we had recommended, and the commissioners had accepted the recommendation to continue a Vivitrol program at Cumberland County Prison that had been funded for a number of years with BCCD funding, but that funding was time limited and it ran its course. So you had approved $188,400 to continue that program. Since that time, the prison staff have been working with Prime Company to come up with good estimates for the cost of covering the other forms of MAT for this current calendar year that we're in, and also looking ahead to the 2024 calendar year. We've also gotten some additional guidance you might remember that early on, there was not a lot of information or clarification provided by the State Opioid Trust Fund. But since that time, they have included a lot of information on their website, many responses to questions. So that was part of the puzzle as well. Exactly what prison-related costs would be eligible in their minds. And so we've done that work, and we have come up with a pretty firm estimate for 2023, the year that we're in. And we think the total cost of providing the MAT programming and related services at the prison will be $135,878. That's included in the materials that you received. This includes a revised estimate on the actual cost of the Vivitrol program. Utilization of that program has dropped since the other forms of MAT have been available. And then we've projected the cost for 2024 and for the full year. And that would be a full implementation of all three forms. We're estimating that cost to be $450,621. And you have included with the materials a breakdown of those expenses. So between the 2 years, 2023 and 2024, we're projecting a total cost of $586,499. And that's what we're recommending be committed. And let me pause at this point and see if you have any questions, particularly questions about the specific costs. And Rebecca is prepared to respond to any of those.
Jack, I have two questions. I remember seeing a chart not long ago. And year one payments, the settlement, you state here $958,000. Each subsequent year, it's going to be what, about $400,000.
You know, it's a moving target.
Okay.
So, I had done an average on the 18 years and came up with about 450,000 as an average, but it really fluctuates from year to year. And those calculations were just based on the first wave of settlement payments. We're told that there is a second wave. We thought that it would be resolved by now, but it is not. We were given preliminary estimates of that. I think those estimates might turn out to be high because some of the companies involved in the second wave have filed for bankruptcy. So that's going to affect their ability to make payments to the settlement. That's not true of the first wave. Those numbers are pretty solid, but we're anticipating that there will be additional money with the second wave. Another question.
One other one, yeah. Are the other forms of MAT more effective now than Vivitrol? Is that why?
That's a topic of debate.
Okay.
And I think choice between the three is largely sort of a preference. The one difference that Vivitrol has is that it is not a narcotic itself. So for someone who has a strong interest in eventually having a drug-free recovery, that's the one that doesn't. Now, Trexone, the generic form of Vivitrol, blocks the body's ability to feel the high associated with using heroin or fentanyl or other opioids. It also, for many people, not necessarily all people, for many people, it quells their desire or their cravings for an opioid. And so that's why some people prefer that route. Methadone and buprenorphine or Suboxone are forms of opioids themselves. And some people refer to them as replacement therapy as opposed to medication-assisted therapy. They replace the addiction on heroin or other opioids with this other form of opioid with a low-level dose that allows somebody to carry out their day-to-day responsibilities. For some people, Suboxone or methadone may be a life-sustaining medication that they continue the rest of their life. Others may reach the point where they have regained control of their lives and they may move on to a drug-free recovery. But there's not a one course of action for each individual. That has to be an individualized treatment plan between a person, their physician, and their drug and alcohol counselor. Good question, though.
Well, thank you. That helps me understand. That's all the questions I have.
Doing the same thing. These alternatives, though, they've been around for quite a while, so their efficacy is no. It's not that they're.
They've all been around. Methadone has been around for decades. It's probably the most researched. And Suboxone or buprenorphine has been around for at least 20 years. And Vivitrol for about 10, 15 years. Yeah, they're all, in order to receive FDA approval, they have to have research indicating their effectiveness.
I don't have any other questions. Hear anything from Commissioner Fauci?
Yeah, I don't have any other questions. And Jack, I really appreciated the update that you did yesterday. I thought it helped tremendously as we moved into this.
Sure. And yeah, the only other comments I'll make then is that we do know that you might remember there's an 18-month spend requirement, but we have been told that we can get a 6-month extension. Originally, when I asked that question, they said you have to request that at 12 months. So I did that. I got an answer back saying, no, you have to request that at 18 months. So, but it will automatically be approved. So we know that the first 2 payments will have until September 1st of 2024, and then the end of December. So we'll have all of calendar year 2024 to expend those first 2 payments. And we do expect a 3rd payment to arrive in December, mid to late December. We've been given a couple estimates of that. I'm hesitant to announce what that might be because the estimates were different. It could change, but there will be more funding available as well. If you commit this $586,499, it will leave a balance from the first 2 payments of $371,501. And as we had discussed before, the plan would be to make that available in grants to community organizations and possibly to other county departments that have opioid-related programming that would fit the requirements of Exhibit E for the settlement. And so that $371,500 plus the 3rd payment are the funds that would be available for grants. I am recommending, if the commissioners are comfortable, that you take action on this so that we can, well, in part, it allows us to then move forward and with plans for the rest of the funding. We wanted to make sure this was covered first. And we also want to be able to Well, one of the additional pieces of information we got from the State Opioid Trust is that we now do have a report form. I had an opportunity to take a peek at that in advance, and it's been officially released within the last couple of weeks. The first report will be due in mid-March, but some of the expenses that we want to claim are from this year. And so it would be good to have the approval before the end of this calendar year so that we can make sure that we have an accurate count of those expenses. We can include that in the first report form.
Okay, so you provided us recommendations, so I'll ask if there's interest on the part of the board to take action on this today.
I will move to use opioid settlement funds to cover the cost of medication-assisted treatment at the Cumberland County Prison.
Give a second.
Gene, could I ask that we amend the motion to put the amount in?
I don't have a problem with that. I did wonder about that, but Jack said that it's a moving target.
I think the allocation for future years is a moving target. Is that correct?
Right.
Okay,
I think-
all right. I misunderstood. So I will amend the motion. And Jack, what number should we put in there then, please?
586,499.
Okay, so I will amend the motion. I will say I will move to use opioid settlement funds to cover the cost of medication-assisted treatment at the Cumberland County Prison in the amount of $586,499.
I'll second.
Okay, it's moved and seconded. Are there any additional questions? Hearing none, so all in favor indicate by saying aye.
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 Thank you, Commissioner.
Thank you, Doug.
Okay, that's completes item 4, the topics of discussion. Brings us to the opportunity for any additional business to come before the group. Anybody have anything?
Yeah.
Staff? No? Okay, entertain a motion for adjournment.
Move to adjourn.
You stand